Hello, my name is Kelsey Biddix, and I will be talking to you about cultural competence within healthcare. Before we get started, I have a brief video to show you all.
Changes in the healthcare industry are requiring healthcare organizations to address a patient population that's becoming more diverse, an increased focus on patient satisfaction, and new standards for reimbursement. Organizations that do not sufficiently respond to these changes are at risk for declining reimbursements, lower patient satisfaction scores, reduced engagement of their employees, and an overall decline in their ability to compete and perform in the new environment. With limited time and resources for training, healthcare systems can maximize their response to these new regulatory requirements with cultural competence training. Cultural competence is the ability to provide care to patients with diverse values, beliefs, and behaviors, and tailor the delivery to patients from different cultural, linguistic, and social groups. When healthcare providers and staff communicate effectively and efficiently with diverse patient populations, it increases patient satisfaction, improves adherence to a patient's treatment regimen, and provides better clinical health outcomes. Are your healthcare providers ready to deliver culturally competent care? Drawing on decades of experience in diversity and inclusion training, Korn Ferry has developed a program designed to equip healthcare professionals with the knowledge and tools needed to provide culturally competent care in the transitioning healthcare environment. Breakthrough Cultural Competence in Healthcare is an accredited online training program that takes healthcare professionals and staff through a series of interactive skill-building modules, providing knowledge and skills in a way that is consistent across the entire organization. Designed for immediate application and lasting impact, participants will gain the skills and confidence to better communicate with colleagues and patients, work better in interprofessional teams, and provide culturally competent care that enhances the patient experience. To learn more, call us at 1-800-633-4410 or visit kornferry.com.
Let's start off by defining cultural competence. Cultural competence is the ability to provide effective care for patients who come from different cultures. It requires sensitivity and effective communication in nursing, both verbally and non-verbally. We all begin the process of learning the behaviors and beliefs of our culture at birth. We become assimilated into the culture, and the way that we express is often without conscious thought. Our culture can have a definite and profound effect on how we interact with others, and also how we relate to the healthcare system. Diversity is prevalent in our society, and the patients and our coworkers in our healthcare system today clearly demonstrate that fact. The development of cultural competence is the nursing practice first requires us to have an awareness of the fact that many belief systems exist. At times, the healthcare practices of others may seem strange or meaningless. The beliefs that others have about medical care in this country, and sometimes their aversions to it, may be difficult for us to understand. We must remember that we don't need to understand these beliefs completely, but we do need to respect them. Now let's look at addressing challenges to cultural competency. Barriers to cultural sensitivity in the nursing profession can include stereotyping, discrimination, racism, and prejudice. There are situations in which we may portray a lack of sensitivity without realizing it or intending to offend someone else. Simple steps such as addressing patients by their last name or asking how they wish to be addressed demonstrate respect. Lastly, I would like to talk about simple ways to promote respect. First, never make assumptions about other individuals or their beliefs. Ask questions about cultural practices in a professional and thoughtful manner if necessary. Second, find out what the patient knows about health problems and treatments. Show respect for the patient support group, whether it is composed of family, friends, religious leaders, and etc. Lastly, make an effort to gain the patient's trust for a stronger nurse-patient relationship.